Alexa TV presents in 3, 2, 1. Dateline Schools with your host, Terry Harrington.
All this week on Dateline Schools, been talking about the measles outbreak that we've seen throughout the country this winter and also how we can protect ourselves here in St. Clair County. So we're at the St. Clair County Health Department talking with nursing supervisor Margaret Sturgis. And Margaret, I know we've been talking a lot about how to protect ourselves from the measles, but right now parents have to be concerned a little bit as they're getting ready to get their youngest children ready for kindergarten roundup. What do they need to know, and what information do they need to bring to the roundup to make sure their kids are vaccinated properly?
Well, they do need to bring an immunization record, which they can get from their private provider, or they can call the St. Clair County Health Department, and we can run one of those reports for them, and it will tell us if they are up to date or if they still need immunizations. Kindergarten kids do need to be immunized against certain diseases, such as hepatitis A, hepatitis B, diphtheria, tetanus, pertussis, polio, measles, mumps, rubella, chickenpox, an annual flu shot, and that's pretty much it for a kindergartner.
A lot of shots for those kids.
Yes. Some of those are combined, though.
Now, here's a question for you, because I know I've seen cards with the immunization records on that. With technology, has that made it easier for the health department to then track who is immunized and who isn't?
Well, it's a state law in Michigan that all kids under the age of 20 have their immunizations entered into the Michigan Care Improvement Registry, so it's made it extremely easy to keep track of who needs what.
My guess is it can't be easy working between the health department and the doctor's offices, though, is it?
Well, the doctor's offices have to do that too, so actually it really is pretty easy.
Now, what about the middle school kids and kids going into high school? Are there any boosters or any things that they need before they enter school in the fall?
Yes, middle school age kids or kids who turn 11 should be up to date with everything they should have had when they were in elementary school, but then they also need a booster shot called Tdap, which protects against tetanus, diphtheria, and pertussis. They need to have an annual flu shot, and they need a meningitis shot at this age, and it's a great time for them to start their HPV series. For high school, though, they need to make sure that they have everything that they've needed for elementary and for middle school, and make sure that their HPV series and their annual flu shot is completed.
If a parent isn't sure what their child has or what they may need, where can they get some information?
They either need to talk to their local health care provider, or they can call the St. Clair County Health Department, and we can check the immunization registry and let them know.
We'll be back with more tomorrow. For Dateline Schools, I'm Terry Harrington.